You know, if you've got arthritis, I'm sure you've heard this a million times. You need to exercise. But that advice can feel like a total contradiction, can it? When your joints are screaming in pain, the absolute last thing you want to do is move. It's a really frustrating spot to be in, and that's exactly what we're going to tackle today.
So let me just ask you, straight up, does the very thought of exercise with your joint pain just fill you with dread? If you're nodding your head right now, listen, you are so not alone. This is the big hurdle for so many people. And this really hits the nail on the head. The fear of more pain, the fear of injury, it can just zap all your motivation. It's a powerful feeling, and it makes perfect sense. But what if I told you that avoiding movement is actually part of the problem?
This is so key because while that fear is 100% real and valid, not moving can actually trap you in what experts call a vicious cycle. It's this frustrating loop that feeds on itself and can make your arthritis symptoms even worse over time. So let's pull back the curtain and see what's really going on here.
So it all kicks off with this: the pain, the stiffness, and makes you think twice about exercising. So you move less. You skip the walk, you don't stretch, you grab the elevator. It's a totally natural protective instinct, right? But here's the thing. That lack of movement, it has a real physical cost. When we don't use our joints, the muscles around them get weaker and the joints themselves get even stiffer. We actually start to lose our range of motion and overall function just because we're not using them. And this is the final kicker that closes the loop. That loss of function, it puts even more stress on that already angry joint. This makes the arthritis worse, and you guessed it, leads to more pain, which of course just reinforces that original fear of moving, and the whole cycle starts right back up again. Okay, I know that sounds pretty grim, but the best news is that this cycle is not a life sentence. You can absolutely break out of it. And it's not about just gritting your teeth and pushing through agony, no way. It's about a total shift in how you think. It's about moving smarter, not harder. So, how do we actually break this thing? Well, we need a new game plan, a new set of rules for exercising with arthritis, and it all comes down to finding the right kind of movement. The source material gives us 3 simple foundational principles to guide us.
Just 3. That's it. We're not talking about some super complicated hour-long gym routine. We're talking about 3 core ideas to keep in mind. And here they are.
The entire strategy here is about supporting your joints, not punishing them. So first up, gentle stretching to improve your flexibility without putting a lot of force on anything. Second, building up the muscles around the joint so they can act like a natural brace. And third, getting that heart rate up with low-impact cardio. Think swimming or walking in a pool, where there's no harsh pounding. Okay, that all sounds great in theory, but what does it actually look like? Let's get practical. Let's jump into a solution you can do like right now, literally in the next 3 minutes, without even getting up from your chair. We are going to walk through a super simple but incredibly powerful exercise called the leg and ankle extension. And it's designed to do exactly what we've been talking about, following those principles of safe, supportive movement. Okay, you ready? Let's walk through this together. Step 1, just sit in a sturdy chair with your feet flat on the floor. Easy enough? For step 2, lift one leg straight out until it's parallel with the floor. Now flex your ankle, pulling your toes up toward the ceiling. Hold that for about 10 seconds. Great. Now for step 3, just point your ankle the other way with your toes pointing down to the floor. Hold that for another 10 seconds. That whole up and down movement is 1 rep. For the last step, you're going to repeat that about 10 to 15 times. And then, of course, switch legs and do the other side. Now to make sure you're getting the most out of this and staying safe, a few quick reminders. Pop a cushion behind your back if you need to, just to take any strain off your lower back. If things are feeling extra stiff, try a warm compress on your knee or ankle for about 15 minutes beforehand. And here's the pro tip. Try to keep that leg lifted for the entire set. That's what really builds the muscle endurance that helps support your joints. I know. It seems almost too easy to actually work, right? But seriously, don't let how simple this is fool you. This one little movement can have a surprisingly massive impact on your joint health. Just think about everything this one exercise is doing for you. It's strengthening those crucial muscles around your knee and ankle. It's improving your range of motion. It's getting the blood flowing. And most importantly, it's hitting our main targets, relieving pain and helping you get your function back. You're literally breaking that vicious cycle with every single repetition. And hey, this isn't just some random stretch someone made up. It was actually developed by an orthopedic surgeon, Dr. Jing-lun. What's so cool about it is how it cleverly blends the science of modern sports medicine with the wisdom of traditional wellness. It's kind of like a whole philosophy packed into one simple movement. So here's the bottom line. Breaking that cycle of pain doesn't have to start with some huge, scary workout. It can start with just 3 minutes. 3 minutes a day in a chair. It's a small step, for sure, but it is a powerful step away from fear and toward getting your life back. So the only question left is, what change could that first step bring for you?